Hey guys, my name is Kevin. I'm one of the exercise specialists with the West PrimaryCare Network, and today we are here at the Jamie Platts YMCA to show you guys what we normally do with our supervised exercise program. So one of the things that we teach and get our patients to do is a full standard exercise program. So we're going to run you through all of those today. This is intended for you to kind of watch to know what to expect before you come to our supervised exercise programs, and also just to kind of reaffirm some learnings that you've had along the way. So we're going to go through cardio equipment, treadmill, bike, and rowing machine first, and then after that we'll take you over to the weight machines. That's going to be probably the extent of video one. And our second video is going to be what we typically teach in the second half of the exercise programs, like cable machines, knee extension, knee flexion, and yeah, that's about it. So let's go off to the treadmill. So this is the treadmill. The way I like to set up the treadmill is basically just hit the go button. So green means go. There's always these programs that you can do, like under choose workout. You can do intervals and cardio workout. For the duration of the program, I just want you guys to do manual. So that would be hitting go. So I hit go. It's going to count down 3, 2, 1. I want you holding on for that time. And then the belt is going to start really, really slow. So it starts at 0.5 miles per hour. You can increase it either here, or your speed is in the bottom right corner, and you can hit the touch screen there as well, until you're up to just a comfortable speed. A lot of people end up going like this, and they're leaning forward. I want you to really focus on feet underneath your shoulders and take nice big steps. Or another thing people do is take a whole bunch of little small steps. So try to take bigger, confident steps as you go. We're not going to do incline for a little while, but eventually incline option is on your left-hand side here. Yeah, and then you can see our warm-up and cool-down video, but if this is your first thing you're doing in the program, I want you to start for 3 to 5 minutes at a slow pace, and then you can increase your speed up to a faster pace, okay? And then the same thing with every cardio program or cardio that you're gonna do. I want you to finish with a cool down. So if you hit the cool down button, bottom left of your screen is a blue downward arrow, so that would be cool down. If you hit that button, your timer is going to count down from either 1, 3, or 5 minutes, and it's going to automatically cut your speed in half for 1, 3, or 5 minutes. Basically forces you to walk slow for at least a little bit of time at the end of your walk. Okay, so that's treadmill. Okay, so this one is called the recumbent bike. So recumbent basically just means a sitting position, and then obviously we're biking. Underneath your seat, there's a red handle that will move your seat forwards and backwards. So when you're pedaling, if you're too close, then your legs kind of shoot into your belly. And if you're too far away, it feels like your legs lock at the end of everything. So we basically want to be, I usually tell people 90% extension of your leg. So for me, I should be about there. I don't want it to feel like you're having to reach for the pedals or that your knees are locking with every pedal stroke. So just a little bit closer than where your knees lock. I'll tell people go until you're too far back and then come a little bit closer. And then from there, we're just gonna hit go. There's always the options for interval training and cardio workout. Just green means go, keep it simple. On the bottom left of your screen, there's a level button. You can hit level 1, 2, 3, 4, or on your right handle here. So sometimes people are holding on to this and they don't realize that there's two buttons here. This will increase and decrease your resistance for your pedaling. And then the same thing for every warm up and cool down. I want you to start, first couple minutes, start slow. You can increase your intensity after a couple minutes and then decrease your intensity as you get closer to the end of the workout, or hit the cool down button. Either or. I just want you to start slow and finish slow. Never, ever, ever finish your workout really out of breath, or finish your biking session really out of breath, okay? And then hit stop when you're done and wipe down your machine. So this is the upright bike. The upright bike is pretty similar to the recumbent bike. We have a red handle underneath our seat that can lift us up and down. Usually what I'll do when I'm setting someone up on the bike is I'll basically get them to, I'll increase their seat height until they're too high. And it's like, oh, I feel my knees locking a little bit. Just go slightly below there, and then that's pretty much your correct height. There's a number on the front of the bike stem, so look at your number on your first day, and then you can just set it up to that number going forward. And there you go, you're pretty much ready to go. From here, the green beans go, we hit that button, and then after we hit that button, it's the same idea, warm up for a couple minutes, increase your intensity for a few minutes, and then do your cool down at the end. That's the upright bike. So this is the rowing machine. So the rowing machine, first thing that we do is I want you guys to set your resistance. So level 10 is all the way at the top, level 7, level 5. Usually I find anything below level 5 is not enough resistance. So somewhere between there. Next level or next thing to set up, make sure that these toe straps are open big enough for you to be able to fit your feet in. So I open them up quite a bit first, and then the next thing is you can adjust this thing here depending on how big your feet are. Michael Jordan's feet would be all the way back, and then if you went all the way forward, if you have tiny little feet, then you can go forward. Usually I find setting number 3 on this accommodates pretty much everyone's foot, so I usually just put it to 3. Next thing, I want you to grab the handle first and pull it back. I'll show you why it's better to grab that first later. Put your foot in, pull the strap tight, and pull the other strap tight, and now we're pretty much good to go. If you had not grabbed the handle first, you need to have enough flexibility to be able to grab it with your feet attached to the rowing machine. So, pretty much from here, you're good to go. I like to grab the outside of the handle. I find I can use my back muscles a little bit more if I grab wider rather than more narrow. And then the way I usually teach it is, first of all, I want you to push with your legs and then with your arms. And you pull into the top of your belly, bottom of your chest, okay? So, push with your legs, pull with your arms, and then bring it back. Push with your legs, pull with your arms, bring it straight back. Legs, arms, and then we pretty much just do this over and over again. Out and back if you can. Make sure that you want this to stay level the whole time, not so that your arms are kind of going up and down and lots of extraneous movement. Have it go forwards and backwards just like that. It's a little bit more efficient. Legs, arms, and then the same idea. First couple minutes start slowly. You can increase your speed a little bit later. Last couple minutes finish slow for a cool down. What I find with the rowing machine, it's not as much about how much resistance you have on there, it's about how fast you go. So on here, normally I'll change the setting to time per 500 meters, and that is going to be the piece that tells you really how fast you're going. A lot of people hop on here and they don't think it's very hard for the first couple minutes, and it catches up to you pretty quickly. So try to pace yourself, go slow. If you can last more than like 5 to 10 minutes, I'd say you're doing pretty good. That's a rowing machine. Okay, so this is the lat pull down machine. So the lat pull down, the main setup for it will be, when you grab it, I want you to grab just outside of where the bar kind of starts to angle down there. So normally I'll grab it there and there. The other thing we need to set up before we get on is usually I just get this bar out of the way. I'll show you the alteration for this at the end of the video if you can't get on the normal way. So I'm going to grab slightly wider than there, and then I'm going to slowly sit down. And now basically you're set up for, what I'll tell people is pretend like there's a string attached to the back of your elbow and pull that string to the ground. And we stop about at neck height down to about there. That's what it should look like. What it should not look like, and what a lot of people struggle with, is they go like this and they push down with their hands. Or if you watch at my elbow, my hands start to rotate forward. So that's no good. That's using your rotator cuff, and that is a good way to tear it. So what I would tell people is I want your forearms or your pinkies to stay pointed towards the sky. Right, so this is good, 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 bad, 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 bad. Okay, so stop there. or bring your elbows into your ribs, and once your elbows are into your ribs, that's it, okay? Up and down, 1 to 2 seconds each direction, just like that. So the adaptations for this, you could do this standing, or what I like to do, I turn around backwards, and you can actually just sit on the pad here. Careful, because that might stab you in the butt, but you can sit on the blue pads, grab just the same, and you can either do it from here, or you can slide down and then do it from here. I usually find if anyone has any knee and hip problems, they have a difficult time getting onto the seat. So this allows them to have a little bit more safety as they can back into the pads. So that is the lat pull down. So the shoulder press machine, the way that we're going to set this up, it's a lot simpler than the other ones. Just the handle up or down. I want your shoulders to be just underneath the bars. That's really all I'm looking for. If you're too high, it's really hard to get your hands on there, and it's really hard on your shoulders. So just make sure that your shoulders are below the bar, and that's all I really care about. From there, we're going to set our weight. You can grab the outside handles or the inside ones. I find people with shoulder problems tend to like the inside handles better. So either or, whichever one feels good. If you can, I like to put my head back against the backrest too. It just makes me feel a little bit more stable. And then push straight up, back down, and up and down. Once again, either those handles or these handles. And also, if you forgot, the 5-pound weight adjustment, if I put that on there, that would be 25 pounds, which is just a way to slowly work my way up. I find this machine very hard. It's the hardest machine out of the bunch, and lots of people do have shoulder problems, so just be careful with it. If you can't do this without pain, then just go ahead with the dumbbell shoulder press. So the sit to stand is one of the leg exercises that we do. The way to change the difficulty for a sit to stand is changing the height of the platform that you're standing on. So I'll show you the variances later. But basically, feet should be shoulder width apart or just slightly wider, whatever feels kind of comfortable for you. I don't want to be super wide and I don't want them to be super narrow, but somewhere, wherever feels comfortable. From here, squeeze your butt first. I like to put my hands out in front of me to counterbalance my weight and push your hips forward. Sit down, under control, squeeze butt, push hips forward. So this one, we're trying to use your glute muscles to be able to go up and down. The other thing I don't want to see is that your knees cave together. So don't let your knees collapse together. Keep them out over top of your second toe. So that's about what I would do for that. Other things that we can use here is a bench, as you can see, is a little bit lower than this is. And you can, these are great because you can change the height to whatever really works for you. And this is a 3-inch, 6-inch, 12-inch height, so you can change the height of whatever you're sitting down and standing up on. The other way to change the difficulty level is to move your feet forward or backwards. So if I were to go like this and stagger my feet, I'm using my right leg a lot more than my left. So right butt squeeze, up and down. My left leg's there for balance, but for the most part I'm using probably 80% of my right leg. And then this one I would need to switch legs and use my left side. Left butt squeeze, up and down. And hands are just counterbalancing basically so that you kind of stay balanced forward and backwards. So that is the sit to stand exercise with the variance. Just keep in mind, if you're doing this from home, the higher the chair, the easier it is. The lower the chair, the harder it is. Okay, so this is the seated row. The seated row has two main adjustments for your seat. One of them we can go forwards and backwards, and the other one will be the height of your seat. So what we're looking for is, I want the height of your seat, I want your chest to be about in the middle of the pad. So I would go a little bit lower, and that's about good for me. So I call that the chest pad. Put your chest in the pad. Next thing we need to do is move ourselves forward or backwards depending on how long our arms are. So I want you guys to just barely be able to reach the handles. Personally, I tell people to either grab the vertical handle here or the underneath handle. I find when people use this handle, they tend to shrug their shoulders too much. So grab that middle handle or the bottom one. I want you to sit up nice and tall. I'll tell people, pretend like there's a grape between your chest and the pad. We don't want to squish the grape, but we also don't want to let the grape fall. So your torso should stay still during this exercise. We're pulling back, forwards, pull back, squeeze your shoulder blades together. Forwards, pull back, squeeze your shoulders together, and forwards. I want to see vertical lines in the back of your shirt. So right here we should see vertical lines. That's a sign that you're using the right muscles. You can cheat during this exercise and just go like this and keep your back rounded. If you see no vertical lines, you're not getting the purpose of the exercise. So from here, pull back, squeeze shoulders together, forwards, and once again, I don't want to see your body moving. Your body should stay, your torso should stay still, just like that, okay? Set it back down, that's the seated row. So this is the chest press. The way that we set it up is we want these handles to be about the height of our armpits. And I just want your feet to be stable on the ground. So it doesn't really matter if they're on this bar here or right on the ground. As long as they're stable, that's all that matters. The way we adjust the seat height is there's a handle here that will move your seat up and down. So move it up and down until this is about roughly the height of my armpits. I'm good to go. Another kind of sneaky little adjustment in here is right below me to my right hip. You can move these handles forwards and backwards. So if you have really good shoulder flexibility and can get your hands really far back, then great, you can do it from there. If you don't and you can't get them as far back, or you just come to this machine one day and it's really hard to get your hands on there, realize that that adjustment might make it a lot easier for you to get your hands on. So from there we're going to set our weight and then we will start pushing. So grab the handles. I'm going to go a little bit farther back and forwards, backwards, about 1 to 2 seconds each direction. And yeah, I like to just kind of touch the weights together. That's a good sign that it's set up properly. I don't want to hear big clanks. That's not what we're looking for. So nice and slow and controlled each direction. And another thing that some people miss is that there are these little 5-pound weights here that we can add. And if I click and put that on, I have 40 pounds here plus these 2 5s, which would get me to 50 pounds. So realize that those 5 pounds can be a bridge between the 2 bigger weights on the weights. So that's chest press. Okay, so the next one is going to be the step up. So they have these steps kind of down the hallway by the where the employee's office is. Yeah, so we can change the height of this step. So this is about 6 inches. If we wanted to make it higher, these little guys pop out and like that, and then just pop into the bottom there. Yeah, it's kind of hard. And we'll do the other side. That pops out. That going in, and we're good to go. So that would be about an 8-inch step. So the higher the step, the harder it is. From here, I like to have the step in front of something I can hold onto for balance. I don't want you like holding onto it, but keep your hands close to it just in case for balance. We're going to put up one leg, squeeze the right butt, and push the right hip forwards, up and down, just like you're climbing a stair, but we're going to do a whole bunch on one side. One mistake that people make is they go up with one leg and they come down with the other, and then up with one, and then down with the other. When I do this, I want to tire out one side completely, so going up and down like that. And then once this side's tired, then I switch to the other side, and I just go up and down. The same leg, I tell people that foot is glued onto the step. Up and down with the left leg, okay? The other thing I'm looking for is don't let your knee collapse in like that. I want your knee over top of your toe. Stay in good alignment so that that's not happening, okay? That's the step up. Okay, so that's been everything that we do in our supervised exercise program. Thanks for watching.